Hi, my name is Dr. Sara Rodgers. I'm a naturopathic physician with an office in Boise, Idaho, and Ontario, Oregon. And I'm here today with Connie Peterson of Riverbend Counseling in Eagle, Idaho. Welcome, Connie.
Thank you.
Yeah, so you have a counseling practice that helps a lot of people with anxiety. And I wanted to talk to you about that because we are all going through so much worry at the moment, whether it is worrying about how to get kids to school safely, whether it is about wearing a mask that is anxious for some people, whether it is about worrying about our neighbors, friends, and loved ones that might be in nursing facilities or institutions, or even just about the fact that we are not able to socialize in the same way during this COVID-19 pandemic. So I am hoping that you are able to talk a little bit about how you address anxiety in your patients and how you can provide some techniques today that can help people today and every day and do some practices that they can do every day to help reduce anxiety.
Okay. Yes, I'm happy to speak to that because I certainly have noticed not only in my clients, but just in our population
Mhm.
overall, that there definitely is a heightened sense of stress and anxiety in people. So it is really a very difficult time for all of us to manage. And it seems as though there's not one person that goes unaffected by this. So I think it is important to discuss this topic of ways that we can work to bring ourselves back to calm or to reduce that level of stress a bit. So some of the things that I've been talking about with clients in general is, first of all, recognizing that anxiety in our bodies and the way that it makes us feel, typically with that elevated heart rate and rapid respirations and tight muscles, all of the things that happen to us when we have a lot of stress or anxiety. So it is important to learn how to bring ourselves back to calm so that the body doesn't stay in the body and the mind don't stay in the space of chronic fight or flight. So some of the simple things that we really talk about right now are ways that they can breathe that really helps the body to bring to calm. So I help them in noticing their rapid breathing and then just trying to slow that breathing in a sense that numerous times a day to catch yourself in that anxiety and then slow the breathing. So you're maybe breathing in for about 4 counts and then out for about 6. Or there's also a method called diaphragmatic breathing or belly breathing that I know you know about
Mhm.
that also can help the body really come to calm. And that just means basically maybe breathing in through the nose for about 4 counts. And when you're breathing in, the belly pushes out. And then when you breathe out for about 6 counts out the mouth, the belly goes in. So you can take a look at that on YouTube. There's several videos that demonstrate how to use that. But those are the simplest things that we can use, all day long to continue to work to bring our body back to calm. Yeah, the other things that we've really talked about is we all are spending a lot more time on social media and being saturated with news. So many of these stories, right, are difficult because we're
Mhm.
talking about, COVID and riots and a lot of different things that are pretty scary that are happening in the world. So limiting that amount of exposure to that, of course, it's important for all of us to be informed to a sense, but I think it's important to also limit that type of negative exposure that we're having to that. So maybe checking in with that for 5 or 10 minutes each day and then shutting it off and really being intentional about adding something else into your life that is a little lighter or that may have a sense of humor, something that can bring a sense of happiness or calm. And then the other thing that is happening to all of us is the things that we normally do to reduce anxiety, which is to spend time with family and friends, to go to the gym and exercise, things like that. We don't have in our life. That lack of connection has really been significant,
Mhm.
has really significantly infected people. So it is important to find new ways, a new norm right now with COVID of ways to be able to safely connect with people, to be able to get outside and social distance, to talk on Zoom or FaceTime or however we can stay in touch with our friends and family. And then to find ways of being active, to move, to be outside that's safe, because all of those things are just natural ways of reducing stress and anxiety, but we've lost a lot of them during COVID.
Right, right. Those are all great techniques. And one of the things that I do for people in my office when I'm teaching diaphragmatic breathing is I
Mhm.
actually have them put their hand on their chest where their
Right,
auxiliary muscles are for breathing. We don't want to use those, and put it on your belly button and take a deep breath. And if you're doing this and this hand's moving up and down, you know you're not doing diaphragmatic breathing. But if you can breathe where this hand stays absolutely still and you're just using your diaphragm, which is that big muscle that goes horizontal above your stomach, separates your
right.
lungs from your stomach, stops the lungs from falling down,
Mhm.
stops from your digestive system from going up into that space. If you can use that to breathe, then the belly button hand will move in and out if you're doing that. So as you
Right.
breathe in, this is really it's really hard to teach people this. It's not hard to teach, but it's sometimes hard to get it done. It takes a little practice. So as you breathe in, your diaphragm should go down. It allows the lungs to expand. The diaphragm goes down, and then the hand on the belly button goes out. And then when you breathe out, the diaphragm goes up, squeezes those lungs, pushes the air out, and your hand goes in. So just taking those long breaths, not only, as you said, reduces anxiety, but I've actually seen people be able to reduce their blood pressure. We had an 84-year-old woman that we taught. It took a little while for her to do this, but
Mhm.
after half an hour, she dropped her blood pressure by 30 points. So this is an
Yeah.
amazing way to open up the blood vessels, relax those muscles, and reduce that stress response that you talked about, which is so, so important. And then
Yeah, mhm.
go ahead.
I was gonna say it really is important, it sounds like it's a little bit challenging to do, but really when you practice it a little bit and you
Yeah.
can sit down or lay down and practice it, but it's such a simple way to bring the body back to calm. There's that physiology to it where that involves the vagus nerve that tells our brain that literally it's time to come back to calm. And so you're right, it doesn't only just reduce our feeling of stress or anxiety, but it absolutely can make those changes in the body. And prolonged chronic stress, of course, as you know, really causes a uh, significant damage to the body.
Right. And also the vagus nerve is labeled vagus because it's the Latin word for wanderer, which means
Yeah,
that it has so many different effects. It affects the cardiovascular system as well
yeah,
as the digestive system. And so when you can calm your digestive system down, if you're having any digestive issues, you can aid in the healing of the digestive system. And if you think about it, it's something we all do every day, which is breathing. So if we
yeah,
just take the time to practice this, that when we get into a stressful situation, we can take a moment or two and reset and do that little diaphragmatic breathing and do what you were saying, in and out through the nose, and or in through the nose, out through the mouth. You can count
right.
and prolong those breaths, and you can reduce that stress response in the moment. So
Yeah,
amazing tool that can help heal not only the mind but also all the other systems in the body, which is just something that we do every day.
absolutely. And it's nice to have some really simple tools that you can utilize to reduce anxiety and stress. And certainly that's one of them that you can, if you get practiced at it, it comes natural. And so we naturally do it when we get into stressful situations. I like it again because it's simple and we're not trying to have to sit down for 20 minutes to meditate or an hour to do yoga. We can do it in that moment. But of course, those things that I just mentioned, meditation and yoga, are very healthy and wonderful things to do to off put stress and reduce anxiety as well. So there's many things that people can look into. It's really kind of finding those tools that you feel work best for you and then incorporating those into your self-care routine.
Right. And yoga is one of those things. There was a book written about all the myths about yoga. And one of the things that they did find that's scientifically valid about yoga is it reduces the stress response because you're
Yeah.
asking the body to do a little activity and then you rest and you breathe.
Hmm.
You're always breathing through each one of those poses.
Yeah.
So, yoga and meditation are also an amazing set of skills that can be done easily in the home. given a little time for rest and relaxation. And when you talk about breathing as natural, if you've ever seen a baby breathe, they're naturals. That's how they do it. They do diaphragmatic breathing. And somehow along the way, we lose that mechanism. But if you watch a baby breathing while they're sleeping, their belly goes up and down. And it's like
Oh,
they're naturals. So we all have done this. It is something we just need to relearn.
yeah, it just takes a little bit of practice, and then it's a very simple solution to learning to bring that body back to calm, which is so necessary in this time of what feels like nonstop stress.
Oh, it is. Yeah. And then when you were talking about the social media and getting sucked into social media, I completely agree. And there's a lot of conversations going on out there, and there's a lot of news, as you said. One of the things about being conscious about social media, I think, is the need for being conscious, because one of the things about that we found is that you can get a little addicted to this because it potentially triggers your dopamine, so you feel good when somebody replies
Mhm.
to you or you're looking for a reply, if you're engaging in social media. So being conscious that if you are getting sucked into some negative news cycles, that being conscious of limiting that social media exposure, as you were saying, is really important as well, I think.
Yeah, absolutely. I agree. And just being aware of the sites that you're visiting and the conversations that you get
Mhm.
into, because there's certainly positive places that we can find that, like you said, give that dopamine boost, but also don't then eventually elevate that anxiety because we're more worried about what's going to happen in this world. So again, like you said, consciously seeking those more positive spaces or limiting that amount of time that you spend on it.
Right. So the act of trying to reduce anxiety, I think what you're trying to say is also we have to be very conscious of of helping ourselves reduce that anxiety level. It's a practice that of consciousness of whether it's breathing, meditating, exercising, figuring out how to socialize safely, all these things we have to, it's not natural to always having to be conscious about relaxation. We have to like be conscious about scheduling it in so that we don't become overwhelmed with what's going on in the world.
We do. It's really learning, especially if somebody who has generalized anxiety
Mhm.
disorder. It's important to learn certain skills that you can utilize to bring down that level. So, in a sense, that you learn how to manage the anxiety versus the anxiety managing you.
Right.
So, it,
Exactly.
it, it is a little bit of a learning curve of saying, okay, recognizing what is anxiety, how does it affect my body, and then what are the tools specifically to each person that work best for them that they can learn to reduce that anxiety. So I like that idea of teaching or learning how to manage anxiety.
Right. Right. Well, Connie, these are really good tools. I'm so glad you shared them today. I also understand that you have a project going on about helping people in the mental health aspect with autoimmune disease.
I do. I became very interested in this due to my own experience with autoimmune diseases, and had to do a significant amount of searching to find resources that were helpful to me beyond medications. And so I'm developing a website that is a collective of autoimmune resources for everybody so that people with autoimmune can go on, be connected to a community, have important information and research, and then also have a lot of these calming activities that we're talking about in videos that they can do in their own home, as well as counseling concepts that might help manage again the autoimmune disease that people have. So it's not up yet, but it's going to be called yourcaregroup.com is a place that you'll be able to find it, but we're hoping to launch that within the next few months.
That is very exciting. As somebody who treats autoimmune issues, I mean, somebody who helps people with autoimmune diseases, this is a really big thing. It's autoimmune is something that it's like your body is attacking itself, and if you can help calm the body down, that is one of the ways to help reduce that inflammatory response. So I'm looking forward to being able to share your website with people, and we'll put that link or that address on this video so people can see it, and
Wonderful.
keep looking for it in the near future. So thank you so
Yeah.
much for your time today. Is there anything else you'd like to add?
No, I think just, for everybody right now, self-care is very important. So make sure to take that time each day to give yourself either that connection or rest or relaxation or whatever it is that you need, because I think that we're going to be a little while navigating this COVID-19 situation. So we've got to find a new way of taking care of ourselves.
Right. And I think of taking care of ourselves as prevention, and preventing disease is so much cheaper than treating disease. And so by just taking care of ourselves on a daily basis with this reducing anxiety, and even if you don't feel like you have anxiety, these tools can be beneficial, as I said, to your digestive health, to your hormonal health, to your cardiovascular health. So even if you don't feel like you have anxiety, doing belly breathing on a daily basis helps you as a whole. So,
Absolutely. Well, thank you for spending this time with me. I appreciate it.
well, I'm glad you agreed to do this with me. So,
Yeah.
and you'll be able to see Connie's information. And if you'd like to contact her, you're welcome to do so. Thank you, Connie, for your time.
Ah, thank you.